Hello.
Hello.
Hi. My name is Lydia.
Oh,
I will be assessing you today and just going over a few things. Can you please state your name and date of birth?
James Harshbarger, August 23rd, 1983.
Okay. And can you tell me the year?
2015.
You want to tell the month, day, and year? Let's try that.
It is October 4th, 2015.
Very good. All right. And can you tell me where you are?
We are at the doctor's office.
Yes. And can you tell me the president?
Obama.
Yes. Okay. Now I checked your vital signs before you came in. Your blood pressure was 125/70. You had a heart rate of 78. It was regular. You had an oxygen saturation of 100% on room air. Your respiratory rate was 18. And your temperature was 98.6. Everything looked really good. Have you been getting sleep lately?
I have.
Okay. All right. So we'll go forward, and are you comfortable where you are?
Yeah, it's fine.
All right. And just we're keeping all the doors closed for privacy, and for safety. You're sitting on the side of the bed, but no dizziness at all.
No.
Okay. Let's see. So we'll go over your start from head to toe for the assessment today, just to explain what we're doing here.
Okay.
And we're just going to listen to your heart, your lungs, your belly, and listen to your bowel sounds.
Mm-hmm.
Check your pulses and your nerves. Check your muscle strength and things like that, just to give you an idea of what we'll be doing.
Sure.
Okay, so I'm going to go ahead and start.
Okay.
Before I start, I just want to clarify I did sanitize my stethoscope. I washed my hands, and I have gloves on right now. Okay?
Okay.
All right. So let's take a look at your hair. Your hair looks really nice and clean. No open cuts, wounds, nothing draining, lesions, anything like that.
No.
Okay, so your hair looks really great. No, there's no dandruff, nothing like that. So everything looks really good. Your ears are symmetrical. Your eyes are symmetrical. Everything looks good. Again, your skin is warm, dry, and intact. It looks really good. Okay.
Okay.
So the first thing we're going to check here is your sensory.
Okay.
We're going to go ahead and put a object, a soft. You just tell me if it's soft or sharp.
Okay.
By the sensation. Okay.
Soft. 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 Sharp. 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 Sharp.
Okay. Well done. I'm going to go ahead and take a look at your eyes. If you'll look straight at me, I'm sorry, it's going to be bright.
Sure.
Just to look straight at me, and we'll shine this light to check your pupils, okay? And they're reacting really well. Very good. Okay, your pupils are equal. They react. They have a brisk reaction.
Okay.
Now we're going to check your accommodation.
All right.
If you'll look right at this pinlet here, I'm going to bring it closer to you and just keep your eyes here. This checks the muscles in your eyes. Very good. And if you'll keep your eyes on here, we're also going to check the another eye test here.
Okay.
Okay. Here, keep your head still. Keep your head in the same place. Very good. Okay, well done. Now, if you go ahead and put your finger on your nose and touch my finger, and again, and your other hand. And one more time. Very good. All right, any problems there? No dizziness, no complaints. Any pain anywhere right now? No, very good. Now we're going to check your tongue and your gag reflex. If you'll open your mouth for me. And while we're here, I'm just going to take a peek with the light and say, ah. Yes, very nice. You don't have tonsils.
No.
All right. Well, you open your mouth for me. I'm going to put this tongue blade on one side of your tongue. And if you'll move your tongue, very good. And we're on the other side. Move your tongue over. And I know this isn't going to be fun, but I'm going to check your gag reflex. Okay. Okay, I'm sorry. Sorry about that. Okay, now we're going to go ahead and look at your ears. I'm going to take a peek in there. Everything looks even, no dryness, no open wounds, nothing draining your tragus, your lobe. Everything looks really good on this side. If you look this way for me. lobe, tragus, everything looks great. Let me peek inside. Great. A little bit of earwax, but a normal amount, not too much. Okay?
Great.
Yes. So I'm going to check your hearing right now. I'm going to close, if you'll go ahead and close one of your ears, plug up one of your ears. I'm going to come on this side and say a word, and you tell me what you hear.
Okay.
All right.
Football. Popcorn.
Very good. All right. All right, you did really well there. Now I'm going to ask you to go ahead and shrug your shoulders. Oh,
Okay.
there you go. And put them back down and try against my hands now. Very good. All right, will you smile for me? And give me a frown. Show me your teeth. And blow up your cheeks. And I want you to you can exhale. Will you lift your eyebrows up as high as you can, and then close your eyes really tight. Very good. Okay, everything looks really good. From here, I'm gonna go ahead and look at your thyroid and your trachea.
Okay.
So if you can just swing your legs over to your right, I'm gonna come behind
Okay.
you here and feel your trachea. If you'll bend your head down, chin to your chest, and tilt it over to your left. Either way,
Okay.
yep, we can do both sides. So either way is fine. And then to your right. A little further down. Okay. Everything feels normal, absolutely nothing out of place here. Your trachea, if you'll go ahead and look straight ahead, is midline, everything looks great. I'm going to go ahead and feel your lymph nodes here. Nothing is out of place, no issues there at all. Feel some lymph nodes here. Okay. Now while we're here, I'm going to go ahead and check your heart. I'm going to listen to your chest.
Okay.
And if there's any issues, anything like that, just let me know. I'm going to start with your aortic. And I'm going to go over to your pulmonic. Your Erb's point. Tricuspid. And then finally down to your mitral. Everything sounds great. Alright, let's go ahead and check your pulses. I'm going to check your carotid. Normal, bounding, very strong, regular pulse. Good. And we'll check your radial pulses. Those are normal, regular. Alright, and we'll check your brachial. Very good. And I'll check your dorsalis. Okay, very good. Alright, and your skin turgor looks great. I can pinch your skin here and it goes back down into place immediately. You're not dehydrated at all. That's really what it's showing here. So
Okay.
your skin looks great. Let's check your capillaries. There you go. Let's squeeze your fingers here and it refills very nice. Very brisk refill. Good job.
Okay.
All right. Let's see. I'll go ahead and listen to your lungs now.
Okay.
All right. And if at any time you feel uncomfortable, if you need to take a break, it's a lot of inhaling and exhaling. So I don't want you to get lightheaded or anything like that. Just let me know if we need to take a break.
Sure.
Now listen to your anterior, the front first, and then your posterior, the back.
Really?
Okay.
Mm.
Deep breath. Very nice. Clear. No accessory muscles utilized at all. So that looks good. And no issues with breathing through your nose or
No.
nothing like that. Everything's clear? Okay.
Mhm.
All right. Take a deep breath. All right. Deep breath. the vesicular and the bronchovesicular lung sounds sound really good. I'm gonna check your bronchial lung sounds now. That's just in the front here, okay?
Okay.
You doing okay?
Oh yeah.
Breathing? Okay.
Mhm.
You good? Very good. Okay. Everything sounds clear. Auscultation. Everything looks really great. Any questions so far?
No.
Okay. Okay, while we've been breathing a lot, I'm gonna go ahead and look on your nose.
Okay.
All right. And you said that there's no issues breathing. Do you
Mm.
snore at night?
Not anymore.
Not anymore. Good. Okay. All right. If you'll go ahead and look up for me, I'm gonna shine this pen light into your nose. Okay.
Okay.
It looks great. No drainage. Nothing like that. Nothing else noted at all. Okay. Everything looks really good.
Okay.
So we're gonna move to some muscle tests.
Okay.
All right. If you go ahead and hold your arms out straight up in front of you. That's really good. Okay, now pull up. There we go. Now push down. Okay, no problems there. That just tests your balance if there's any issues with your muscles at all like that. So
Okay.
let's do the same with your legs. You'll lift your legs up. Very good. And pull up for me. And push down. Good job. Okay. We're going to take a look at your Romberg. There's a Romberg test that requires you to stand up. Do you feel like you can stand up right now?
Sure.
Okay. Let's go ahead and stand up. All right. And what for this test, I'm gonna have you put your hands by your side and close your eyes.
Okay.
Let's check to test your balance. And you seem to be doing well. Okay. Now the next test, I'm going to ask you to pick one foot up off the floor and hop. And the same for the other side. Hop. Very good. Okay. Well done. You have great balance. That's a good thing.
Thank you.
Okay, you can sit back down. Thank you. Now for this next part, I'm going to listen to your belly, look at your belly.
Okay.
I'm going to check your femoral pulses in your groin area here. And I'm going to palpate your bladder here to
Okay.
see if it's any issues with distension of your bladder. That just means it's full for, we just don't want it to be full. So anyway, if you'll lay down for me.
Sure.
All right. Let's see. Okay. So his abdomen is soft, round, and when was the last time you ate?
I guess 2 hours ago.
Okay. And you've been eating well, nothing,
I've been fine.
diet's been okay. And when's the last time you had a bowel movement?
Probably 3 hours.
3 hours ago. Okay, sounds good. So I'm going to go ahead and listen, starting down here in your right lower quadrant. And I'm going to go around in a circle here.
Okay.
And then I'm going to go ahead and kind of palpate to see if there's any pain when I'm pushing
Okay.
anywhere. And you let me know.
Okay.
Okay. Very good. And hyperactive bowel sounds here. Okay. Everything sounds good. Very hyperactive. All right, now I'm going to go ahead and feel your belly. You tell me if there's anything that is hurting you. No pain.
Mm-mm.
Nothing at all? Okay. And I'm going to go ahead and palpate your bladder.
Okay.
Okay, and then I'm going to check your pulses. So there's no issues here with your bladder?
No.
No? Okay, and I'm going to check your pulses here. Very strong pulses. Very nice. Regular, strong, bounding pulses. Okay. Let's see. I am going to, do you have any questions for me right now?
Mm.
Okay, the bed rail's up, so I'm glad that you're not going to roll out of bed or anything. That's a good thing. Yes. Thank you. All right. If you want to set up, one more thing we have to do is just to let you smell a couple things here. Okay. All right. Great job. All right. So I'm going to ask you to close one of your nostrils here for me, and I'm going to let you smell something. You tell me what it is.
Okay.
Okay. All right. Go ahead. Close one of your nostrils for me. There you go. All right. What do you smell?
Vanilla.
Very good. And let's go on this side. What do you smell? Okay. All right. Sounds good. And do you have any questions right now for me at all?
I don't think so.
Any pain right now anywhere?
Okay.
And I know last time we talked about pain in your lower back. Is that still something concerning?
No, that's
No.
it.
It subsided? Okay, good. Anything that helped it, help relieve your pain at all?
No, it just kind of went away.
It went away? Okay, with rest, I'm guessing, or
Sure. Yeah.
not straining yourself anymore.
Right.
That's good.
Yeah.
Okay. Let's see, we'll have a follow-up here to talk about any kind of a teaching plan where we can go forward and monitor some of your complaints earlier in the first assessment.
Okay.
Okay, but right now everything seems to look okay.
Okay.
All right, thank you.
Thank
All
you.
right. Thank you.
Good day.